survival rates for mesothelioma are improving. The good news is that survival rates for mesothelioma patients are improving. A 2015 meta-study looked at 20 years' worth of results from 1992 to 2012. And during that period the two major forms of mesothelioma, pleural and peritoneal, have both seen an improvement in survivorship. Mesothelioma survival rate by type. 1 year pleural 73%, peritoneal 92%, pericardial 51%, 3 years pleural 3%, peritoneal 74%, pericardial 26%, 5 years pleural 12%, peritoneal 65%, pericardial 23%, 10 years pleural 7%, peritoneal 39%, pericardial NA. According to the study, peritoneal mesothelioma survivorship has especially shown significant improvement, largely due to new forms of treatment such as hypothermic intraperitoneal chemotherapy (HIPEC). The effect of treatment on survival. The type of treatment a mesothelioma patient receives can affect survival rates, whether this is due to the treatment itself or to other factors, e.g., if the patient is too ill to undergo more aggressive treatment may not always be apparent. While there has been no single study showing survival rates based on treatment across all types of mesothelioma, separate studies have been done on the two most common forms of mesothelioma. Mesothelioma survival rate by treatment type. Pleural mesothelioma, chemotherapy only, 2 years 19% and 5 years 4%. Pleuroectomy, decortication, PD, 2 years 40% and 5 years 10%. Extrapleural pneumonectomy, EPP, 2 years 37% and 5 years 12%. Peritoneal mesothelioma, CRS 207 plus hypothermic intraperitoneal chemotherapy, HIPEC, 5 years 50%. For pleural mesothelioma, patients who undergo a pleuroectomy, decortication, PD, or extrapleural pneumonectomy, EPP, both of which are usually part of a multimodal treatment plan, generally have a much higher rate of survival than those who receive chemotherapy alone. For peritoneal mesothelioma, patients who undergo cytoreductive surgery, CRS, with HIPEC have significantly higher rates of survival when combined with systemic chemotherapy as an adjuvant treatment. The 5-year survival rate of patients who undergo CRS plus HIPEC can be as high as 67%. Other survival rate factors. The survival rate for mesothelioma patients depend on a variety of factors. These include things such as the patient's age, health, and the treatment they receive. Every individual case is different, and one survival rate may not necessarily apply to a specific patient's case. Stage at diagnosis. Mesothelioma staging can impact survival rates significantly. Patients diagnosed at an early stage, stage 1 or stage iodine monoiodide, have a much higher survival rate than those diagnosed at a later stage, stage 3 or stage 4. For example, the 5-year survival rate for stage 1 peritoneal mesothelioma patients is 87%, but only 29% for stage 4. Age of the patient. Younger mesothelioma patients have higher rates of survival than older patients. This is due in part to the fact that older people in general have lower survival rates. In addition, with age comes a variety of health-related conditions that can make a mesothelioma diagnosis more deadly. Sex. According to data provided by the National Cancer Institute SEER database, women have a higher 5-year survival rate, 16%, than men, 9.3%. It is not entirely clear why this is so, though some reasons may include that women are generally diagnosed at a younger age. They are more likely to get regular medical checkups, and they may be in better overall health. Race. There is some evidence that African Americans who have mesothelioma have a slightly longer 5-year survival rate than Caucasian mesothelioma patients. However, because Caucasians have a much higher incidence of mesothelioma, there may not be enough cases of African Americans who have the disease to make a substantive determination. Genetics. Several studies have shown that certain genetic factors can affect survival rates among patients. For example, mesothelioma patients who have certain mutations of BRCA1-associated protein 1, BAP1, appear to have much better survival rates than other individuals who develop the disease. According to one study, Top mesothelioma surgeons in the country. David Sugar Baker, M.D. Professor of Surgery, Chief of General Thoracic Surgery, Director of the Lung Institute. Map Marker Baylor College of Medicine. Rafael Bueno, M.D. Chief, Division of Thoracic Surgery. Vice Chair of Surgery for Cancer and Translational Research. Map Marker Brigham and Women's Hospital. A note about mesothelioma survival rate statistics. Mesothelioma survival rates are determined by a standard measure known as the relative 5-year survival rate, which indicates how many patients are still alive 5 years after being diagnosed with the disease. According to the most reliable studies, the relative 5-year survival rate for mesothelioma is about 9%, which is better than it was a decade or more ago. However, this simplified number does not tell the whole story. As shown above, survival rate can depend heavily on the type of mesothelioma a person has, what treatment options are available to them, and